Hi, everybody. My name is Gio. I'm a freelance consultant. I've been working in food insecurity work for the past 11 and a half years, and I do the food service guidelines, or which we sometimes call the Healthy Pantry Initiative work for Bronx Health REACH. So I'm just going to kind of give a review of the progress that was made with the project over the course of this year. So I'm going to talk about HPI, going to talk about our partner selection process, how we support the partners, the implementation, and then share some statistics for the program. So HPI has the goal of increasing accessibility, distribution, consumption of healthy foods through the progressive adoption of 5 strategies that support up to 5 objectives in emergency and supplemental food distribution settings. This includes increased client choice, market healthful products, emphasize fruits, vegetables, whole grains, and other staples, and promote additional resources, and also plan for alternative eating patterns. Um, so the reason why we do the HPI work with the community is because we're looking to provide emergency feeding programs with the tools they need to combat hunger, but also to do it in a way that promotes nutrient-dense foods and also culturally preferred foods. So it's kind of taking it a step further from just providing nutrients for people to actually helping to educate them and encourage them and give them tools that will help them combat things like obesity, heart disease, diabetes, hypertension, and other preventable illnesses. So it's like a little more focused way of doing pantry. So when we're selecting our partners, we look for community or faith-based organizations. So this may be churches that have a pantry. It may be school pantries that are campus pantries, rather, at colleges, and other types of community-based organizations that deal with food insecurity and community feeding. We also look for programs that have regular and consistent distribution. So we're looking for, programs. Not everybody has to be super high level, but we definitely want you to be consistent. You have to have some food coming in already. And those are just kind of some of the basic requisites. Also, we look for programs that are in areas of high need. So we want to bring this program and these services and improvements to really help ameliorate things in some of the neighborhoods that need it the most. So the location where the pantry is also something that we look at. We need buy-in from the leadership and the staff. This is something that are sort of a combination of incremental changes that take place over a period of time, but it does require work. It does require change. It does require some things that may at times be a little challenging or different. So that buy-in oftentimes is what really makes the difference from the pantry's success with doing HPI, is that they prioritize nutrition and health to an extent that they're willing to make these changes and go through the process, and for the result that it's going to yield at the end. And then also finally, the program has to have an adequate amount of staff members or volunteers, because some of the things that I'm going to talk about in a minute may require you to have someone do double duty, or maybe even have a person dedicated to doing a specific task or part of the programming. So that kind of staff and volunteer part is also important as well. Okay, so when we're working with these programs, and this is one of the things that have already worked. I think this is my 6th year with Bronx. No, 5th year with Bronx Health REACH. But prior to this, I had already worked in food insecurity for about 6 years. And a lot of times I felt like a lot is asked of community feeding programs, pantries and soup kitchens and things, but the resources and the support is not always there. So one of the things that attracted me to this project as a consultant was that there really is support all the way through the entire process to really put the pantries in a position that they can truly be successful and also sustain the progress that's made and improve upon it even after the partnership with Bronx Health REACH has come to a conclusion. So some of the ways that we go about doing that include providing each partner with a small grant to for participating and completing outcomes throughout the course of the project. Assisting with purchasing support tools. This is things like food displays, sandwich boards to write down recipes or days and hours or promote certain foods, posters and signage, just various different tools that they use, when they're trying to promote the items. Links to additional partnerships. Many of the partners that we work with are a part of this coalition and are able to connect with other types of nonprofits that provide other services, whether it be housing or breastfeeding or immigration and different things along those lines. Also support with grant procurement. Oftentimes, when I'm working with a pantry, they may not be aware of all of the support and resources that are available to them as a community-based pantry. So we oftentimes work to help connect them to like Community Food Connections grant or HIPNAP Hunger Prevention Nutritional Assistance Program grant, and these other opportunities that are available to them. Oftentimes, we also integrate Plentiful into the process, which, if you're not aware, is basically an app for community members where they can look up nearby pantry locations and then oftentimes also make appointments so that they don't have to wait in line as long. They can kind of make an appointment on their phone 24/7 and then show up at the specific designated time to pick up their food items. So that's something that we oftentimes help the pantries with as well. Nutrition education, support and materials. We provided hot plates, mixing bowls, utensils, all of these kinds of things, recipes as well, anything that they pretty much need in order to do the cooking demos. On-site technical assistance that's provided by me. I come to each pantry once a month and work on the goals that we set out in the beginning of the year. So every time that I visit the pantry, we're either doing the training or we're doing a hands-on client choice conversion or we're integrating Plentiful or, we're always doing something on a monthly basis when I visit the sites. We also have virtual check-ins where the pantries meet with myself, Ema, and Kelly sometimes in order to review, make plans, discuss solutions to challenges, etc. And then there's also capacity building trainings like the Healthy Pantry Initiative training that's done with each site at the beginning of the year. And then finally, something I feel is very significant is that each site, when we start the work, they adopt a nutrition policy. So it just outlines the foods, the foods that they're looking for, that they want to give to the community and that they promote. Also, the foods that maybe they don't want, things that are like high in fat, high in sodium, artificially sugar sweetened beverages, and then the way in which they procure food and distribute food, meaning that they prioritize in both procurement and in promotion the most nutrient dense items. And then for the implementation, so it starts out with a pre-assessment visit. I come to the site, I conduct a pre-assessment to kind of see where they're at the moment and what room there is for progress and goals throughout the year. We develop, if the pre-assessment part, if they are selected, then we develop a set of goals that kind of frame the work that we do throughout the year. And then they attend the Healthy Pantry Initiative training, which is like usually about a 2.5 hour training that goes over everything pretty much that I've discussed today, but in greater detail. And then they receive some support materials, including a binder that has a ton of resources from recipes to signage and various different items in it. And also some of the equipment items I discussed prior. Like I mentioned, I do the site visits monthly and we have quarterly virtual check-in meetings. We also work on community need surveys, which focus on getting from the community members what are the demographics that the pantry has, what are the foods that they desire most, and special focus also on what foods from their culture that they would like the pantry to increase if possible. And then finally, it ends with a post-assessment visit and also a sustainability plan so that the program can continue with their progress and success. So for this year, not which by the way, the year starts in October and ends in September, so it just wrapped about a month and a half ago. We worked with 6 partner sites. 5 of those sites received assistance with integrating Plentiful. For our community needs assessment, 145 community members were surveyed. We did cooking demos at all 6 partner sites. One site we assisted with their community garden, and 6 of the sites received assistance with converting to client choice. And then finally, there's just a few pictures here. We have the first picture is from Bible Church of Christ in the Bronx, their client choice distribution. The second picture is also from there. It's an example of the black kind of frame you see there is the produce display that we provide to them. The third picture is from a smoothie cooking demo that Every Day is a Miracle did over the summer. The fourth picture is the posterized version of the nutrition policy that each program signs, a full-length kind of like I think it's a 4-page document, which is more detailed, but this is kind of hyphenated to include in a more visually appealing kind of way. And then we have a client choice distribution at Manna of Life. Just a nice picture I thought looked nice. The fifth picture, or sixth rather, sorry, is one of the volunteers displaying some food at the pantry. And then the last 2 pictures are from Thorpe family residents of their client choice distribution. And then the final one is them doing surveys. And that concludes my presentation. So thank you for listening.